Hi, Jeremy. Thank you so much for coming in today.
Hi, thank you.
So today we're going to be doing a head-to-toe assessment. So that basically involves a quick overview from head to toe of your health and how you're feeling. And if anything sticks out, we'll look into it further.
Sounds good.
Great. So I'm just going to take some notes and ask you a few questions about your health history. So quickly, could you just tell me your first name?
Jeremy.
And could you just confirm your date of birth?
January 1st, 1988.
Perfect. Okay. Just making sure we have the right person here. So, do you have any overall issues with your health?
No, not really.
Feeling pretty good.
Yeah.
Are you in any pain right now on a scale from 1 to 10, 1 being no pain, 10 being the most pain you've ever had?
I'd say 1.
1, so no pain.
Yeah.
Great. Okay. And tell me a little bit about your overall health. Do you exercise?
Occasionally, yeah.
What do you usually do for exercise?
Sometimes I go to the gym, lift weights, sometimes run on the treadmill, do some cardio.
That's great. And how often do you do that? How many times a week would you say?
I try to go 2 to 3 times a week.
That's good, yeah. And just try and, take walks on those days that you don't get to the gym. Just keep your body moving. And then what about your diet? Do you generally, what do you generally eat in a day?
I eat fairly healthy. I try to get my vegetables in when I can.
Okay. And do you have any issues with any foods, any allergies?
No, not really.
Okay, excellent. And no stomach problems with eating?
No.
Okay, cool. How about sleep? How are you getting, how much sleep are you getting every night?
I try to get 7 to 8 hours a
7
night.
hours.
Yeah.
And does that feel like enough for you?
Yeah.
We never quite get enough, do we?
No.
No, okay. Just make a note of that. But it seems like, you're alert. You don't look incredibly tired. You're not drawn out. So I'm glad that you're getting at least that 7 to 8 hours. That's ideal. Some people need a little less. Some people need a little more. So. And have you had any illnesses, injuries, or surgeries in the past 5 years?
No, I haven't.
Okay, great. Okay. And do you have any questions for me before we start the exam?
No.
Okay, excellent. So I'm just going to start off with some vitals. I'm going to start off by getting your temperature. So if you can just open your mouth and put that under your tongue. There you go. You can hold that there. And while you do that, I'm just going to go ahead and check the pulses in your hand. Okay, excellent. Next up, I'm just going to go ahead and check some of your other vital signs, get your blood pressure. Do you have a preference of which arm you like to use?
No.
Okay. Go ahead and stick that arm out for me. So you should feel a little bit of pressure. If it gets to be too much, just let me know. Okay, excellent. Pressure is very good. Next, I'm just going to go ahead and start the head-to-toe assessment. Is it okay if I touch you?
Mm-hmm.
Okay, so I'm going to start by just looking at your head, looking at your hair. Do you have any pain when I do this? Touch your palpate?
No.
Okay. Hair looks clean. No pests or bugs. No dandruff. Okay, and I'm going to just check your lymph nodes here. So let me know if you have any pain. Down the back of your neck. Can you shrug your shoulders for me? That? Okay. Excellent. I don't feel anything there. And then I'm just going to go ahead and look into your eyes. So go ahead and just look right at my nose and ignore the light. follow my pen light with the tip of the pen light as it goes. Don't move your head, just move your eyes. Okay, any double vision with that? Okay, go ahead and look at the tip of my pen and follow it as it goes in. Good. Pupils constrict and react to light and accommodation. I'm going to go ahead and look into your ears. So if you just turn that way. Okay, looks good. Any pain when I palpate the outside of your ear here?
No.
Okay, other side. Any pain there, like that?
No.
Do you have any issues with hearing or hearing loss?
No.
Okay, I'm going to go ahead and make some soft noises next to your ears. Can you close your eyes and tell me which side you hear it on?
Left. Right. Both. Left. Right.
Very good. Okay, so it doesn't seem like there's any issues there. I'm just going to take a quick look into your nose. It's going to involve me gently placing my hand on your nose. Let me know if it hurts in any way. Okay. Do you have any problems with smell or taste at all?
Not really.
Can you go ahead and breathe in that nostril? And breathe in there? Okay. Any issues with blockages or?
I have slight allergies.
Slight allergies, okay.
Yeah.
Do you feel like it comes and goes, or does always one side?
Comes and goes.
Okay, that's pretty normal. I would say like most people will have some occlusion on one side or the other throughout the day. As long as you're not feeling like you can never breathe through one nair or the other, then it's not really cause for concern. I'm going to go ahead and look in your mouth now. Could you open up wide and say ah?
Ah.
Excellent. Do you have any problems with pain in your teeth or anything like that?
No.
And when was the last time you went to the dentist?
Several months ago.
Okay, good. So you go like every 6 months or
Yeah,
so.
I try to get my checkup.
Good, excellent. So that all looks good. I'm going to go ahead and check some of the nerves in your face now. Go ahead and can you smile for me? And frown. And lift your eyebrows up. And can you puff out your cheeks? And don't let me push them in. Good. Okay, I'm going to check some sensation as well. Just go ahead and close your eyes and tell me when you feel it.
Feel it. Feel it. Feel it. Feel it. Feel it.
Good. So cranial nerve is intact. And can you go ahead and clench your jaw for me? Sort of clench down. Do you ever have any problems with your TMJ? Any clicking? Any popping?
Occasionally.
Open and close for me. Okay. Yeah, I feel a little bit of clicking and popping. Does that bother you quite a lot, or?
No.
No, it doesn't bother you too much. It's not too bad. It's not too pronounced. If it gets worse, go ahead and let me know. Okay. And then I'm just going to do a couple other things. Can you go ahead and shrug your shoulders for me? And against my resistance? Good. And then try and turn your head against my hand. Good. And this side? Good. And push your tongue inside onto my fingers. And then over here. Good. Okay, so good strength all around. Your face looks symmetrical. Your eyebrows look good and healthy. The facial hair looks very healthy and doesn't have a lot of ingrown hairs or anything like that. And the lips look good, not too dry or chapped. So, and the lips look good, not too dry or chapped. So that all looks good. I'm just going to take a look at your neck now. I'm going to go ahead and just look for the pulses. Okay, I'm going to go ahead and feel now, one at a time. The other side. Good, nice, strong. I'm going to have a quick listen. You can breathe normally. Okay. Good. Okay, so no bruise, nothing roted there. That all sounds good. So I'm going to go ahead and move on to your arms now. I'm just inspecting your arms for any lesions, bumps, lumps, rashes. The temperature is warm and consistent throughout the arm. And down to your hands, cap refill, less than 2 seconds. Good, the other side. Warm to the touch, no blemishes. Cap refill Do you have any problems with the musculature in your arms? Any pains? Anything like that? Okay. I'm just gonna go ahead and check the strength in your arms. So you can go ahead and put your arms up like this and prevent me from pulling, prevent me from pulling, prevent me from pushing, pushing. Good. Now with your hands, can you go up like that? Prevent me from pulling, prevent me from pushing. Good. And then just with your fingers alone, so like this. Open and close. Any pain there? You open your fingers wide. Don't let me push them in. You keep them closed. Don't let me pull them apart. Good. Good strength. So you can go ahead and put those down. That all looks fine. 5 out of 5 for strength. If you have, any changes in one side or the other, if it wasn't symmetrical, we could look into it further. But you seem totally fine. I'm going to go ahead and check some sensation in your arms as well. Just go ahead and close your eyes and tell me when you feel it.
Feel it. Feel it. Feel it. Feel it. Feel it. Feel it.
Good. So next I'm just going to do a quick sharp and dull. So I'm just going to move this, it's not sharp, but it's not soft, all the way up and down your arm, and just let me know if it feels differently at all. Feels the same sharp all the way up? All the way up? Okay. This side? Feels the same all the way up? Okay. Good. All right, I'm just going to move to your chest now. I'm going to go ahead and listen to your heart and your lungs. So for your heart, you can go ahead and breathe normally. Just going to listen in a couple of spots. Okay, great. Don't hear anything abnormal there. Consistent pattern. And do you have any? Do you ever feel tired after you exercise for short periods of time? Anything that would be concern for your heart?
No.
Okay. I'd say that with good blood pressure means that there's really no concern there. So next, I'm just going to go ahead and palpate the front of your lungs. So that's just going to involve me tapping on your chest and listening to the sound of it. So if you have any pain or tenderness, let me know. Otherwise, you can just breathe normally. Okay, that all sounds good. So now I'm just going to take a listen, and I am going to have you take a deep breath in every time I move my stethoscope. You can also pretend. And one more. Good. Okay, now I'm just gonna go ahead and do the same thing on the back. If you can go ahead and just shift your body. Again, I'm just gonna be palpating, so let me know if you feel any pain. Now I'm just gonna take a listen. Go ahead and take a deep breath in. One more. One on this side. And last one. Good. Can you take a big breath in for me? And let it out. Good. Symmetrical expansion on both sides. Okay, you can go ahead and sit back down. So I'm just going to listen to your stomach for any bowel sounds. That all sounds fine. And I'm just gonna palpate a little bit. If you have any pain, let me know. Any pain there?
No.
Just gonna feel for your spleen. You can take a deep breath in and let it all the way out. Good. Don't feel anything, so that means it's probably not enlarged. So I'm just going to go ahead and inspect your legs, palpating for any lumps, bumps, any pain when I touch. Any pain here? No. Okay. Go ahead and check for, I'm just going to go ahead and zip this. Just check for temperature. Feels warm and dry to touch. Yeah. Warm and dry. Okay, excellent. Can you go ahead and put your legs up? Yep, like that. And pull, keep me from pulling. And push. Good. And you can put your legs back out and put your feet up. Keep me from pulling. You can put them down. Just put your, yeah, like that. And then push down. Good strength on both sides. Okay, so I'm just going to check some of your reflexes down here. So go ahead and put the weight in my hand. Good. Good. And sort of bend your leg out like this. Yeah, exactly. Good. And the other side. Good. Okay. I'm just going to go ahead and check the Babinski reflex. Just going to run this little piece up the bottom of your foot. Might feel a little odd. Good. Good. So I want the toes to curl inward there, and they did. So no sign of the Babinski. Go ahead and sit back up. We're going to finish up with your reflexes and then do a neurological exam. So I'm going to go ahead and check the reflexes in your arm. Go ahead and give me all the weight of your arm. Just go completely loose. Just completely relax your arm. Yeah, perfect. Good. And here, again, completely relaxed. Good. And right here. Good. Okay, on the other side. Again, just completely relaxed. Give me all the weight. Good. Good. Okay, so I'm just going to finish up with a quick neurological exam. So can you go ahead and take your fingers and move them one after the other, just like that. Good. And can you take your foot and slide it down your shin like this? And on the other side. Good. Okay. And lastly, I'm just going to go ahead and put something in your hand. I want you to close your eyes and tell me what it is.
Pen?
Yep. And I'm going to draw a letter in your hand. I want you to, or a number in your hand, and tell me what number it is.
2.
Good. And the other side?
4.
Yep. Perfect. Okay. So overall, I would say that you look really good, really healthy. There's nothing that's given me cause for concern. So do you have any questions before we end our visit?
No, I think that's it.
Okay. Well, I'll see you in a year. And thank you so much for coming in.
Thank you very much.